an inseparable component of health and is directly related to the individual, family, and community well-being. Good mental health enables people to realize their potential, cope with normal stresses of life, work productively, and contribute to their communities. A significant number of persons in our federation are impacted by mental disease. However, not all persons who require mental health care receive it. This mental health day treatment center was erected through a Caribbean Development Bank sponsored Basic Needs Trust Fund project. It is based in the community, and the primary intention of the Ministry of Health is to improve access to community-based mental health care services. This mental health day treatment center has been operational for approximately 5 months now. It operates with a referral system that facilitates the transfer of patients from acute care centers. From acute care at the psychiatric ward at the JNF General Hospital, and also the transfer of patients from the health centers. This center caters to the need of non-violent, mentally challenged individuals who are given the opportunity to receive counseling, medical checkups, occupational therapy, and other therapies. The aim is to provide support for these individuals through the recovery process and optimize independent living. The Ministry of Health and the government embraced this concept of care and invested in this mental health day treatment center. Today, we are here to witness the renaming of this center. I am particularly pleased about this because the renaming of the center will help fight, even in a small way, the stigma around mental illness. As of tomorrow, a client who usually comes to this center can say to his friend, "I have an appointment at the Dr. Arthur Lake Center," as opposed to saying, "I have an appointment at the Mental Health Day Treatment Center." I am thinking that the name change will help reduce the prejudice and discrimination experienced by clients with mental illness. People with mental illness have difficulties getting a job, finding housing, making and keeping friends. The stigma adds to their misery and to the misery of affected persons and their families. It was Bill Clinton who once said, "Mental illness is nothing to be ashamed of, but stigma and bias shame us all." At this time, please allow me to share with you some statistics or data. And I quote, "The statistics on sanity are that 1 out of 4 people is suffering from mental illness." I'll ask you to think about your 3 closest friends. If they seem okay to you, then you're the one. Are you the one?
I welcome you all to this simple but significant ceremony here this morning. Dr. Laws has set an excellent tone in terms of putting in context why we are here, and by extension, why the need for a facility of this nature has existed. This center has been long in coming. It is a center with which I have been associated, would you believe, for somewhere in the region of about 7 or 8 years. And the reason I say this is because my involvement with the center from concept stage began way back in the mid-2000s when, as a member of the steering committee of the Basic Needs Trust Fund, we would have articulated with support from the Ministry of Health at that time the need for a facility of this nature once it became evident that not every single individual who has a mental illness warranted being placed formally as what we termed as the crazy house at the Cardin home, and then later the acute care facility, the psychiatric unit at the Joseph N. France General Hospital. And the reason was simply that mental illness touches anybody and it touches everybody. And at the same time, we also have an obligation, moral and otherwise, to care for those persons who are mentally challenged. We have received statistical reports over time, and Minister Grant can attest to this, in terms of the exit surveys from cruise passengers as it relates to disturbance or nuisance complaints that we would have received over time by persons who are considered mentally ill, some of them being panhandlers approaching tourists in a manner that might appear intimidating, etc. And we were firmly resolved as a private sector back then when I was part of BNTF, and even more so as a government member now in this Team Unity administration, that centers of this nature are required. Now, when this center would have been opened in December of 2016, we would have given a commitment that this was only part one of a two-part project in terms of addressing mental illness in a holistic and sustainable manner that resulted in improved livelihoods, changed lives, and people having a second chance to be reintegrated into their communities. The second phase of this project, which will come down the road, is in terms of an assisted living type of environment, or a halfway house, for want of a better term, where persons who are recovering from mental illness and who are well enough to hold down a job, but not lucky enough to be on their own in terms of paying rent, owning a home, or having your family members accept you to live there, would be able to have a place where they can stay, run by a warden appointed by the Ministry of Social Services, and then they would have an opportunity in that kind of communal setting to have continued therapy and improvement. And that is a commitment that we intend to hold fast to. So we are well on our way in terms of achieving these things. So this morning's ceremony, we are hopeful, will, as Dr. Laws indicated, set a new path and a new attitude and a paradigm shift in terms of the way in which we look at mental illness. I think the 25% statistic that Dr. Laws is enough to tell us that maybe at least 7 of us in here might be mentally ill if you follow the ratio that she gave. Before I take my seat, I would need to acknowledge a few extra persons in the audience, and they happen to be retired matron of the Joseph N. France General Hospital, Sylvia Garnett. Thank you for being here, Nurse Garnett. I also would wish to acknowledge Alethea Gums, who happens to be the daughter of Monica Gums. Monica Gums has been the long-standing secretary as well as office manager of Dr. Lake for well over 30 years, and that would constitute maybe about 75% of his business life, because my data shows me that he would have been in practice for over 40 years at that clinic on 4th Street. So we are very grateful for you to be here, Alethea. I know that your mom couldn't be here today, but we thank you for your presence. I do trust that the rest of the ceremony will be interesting and productive as we move towards the unveiling of the sign. Thank you for your attention.